Hi, I'm Dr. Anthea Rhodes, paediatrician at the Royal Children's Hospital in Melbourne and your host for the Winter Wellness series of the Kids Health Info podcast. Today we're going to be talking about hand, foot and mouth disease, which is quite a common infection and we tend to see a lot of it over winter. To tell us more about this and some advice on how to manage it at home and help stop the spread, joining me is Dr. Sarah McNab, paediatrician and director of our Department of General Medicine. Welcome, Sarah.
Hi, Anthea. Thanks for having me.
From the Royal Children's Hospital Melbourne, this is the Kids Health Info podcast.
Let's start with a really common question parents have. What actually is hand, foot and mouth disease? It sounds awful and quite serious, but is it really?
Hand, foot and mouth disease is a common viral infection in little children. Yes, it does sound very dramatic, but in most cases, it's a relatively mild infection. One of the things that we classically see with hand, foot and mouth, as you would expect by the name, are lesions around the hands, the feet and the mouth, sometimes inside the mouth and interestingly sometimes around the bottom as well. So what I mean by lesions are that they're little sores or little blisters. Some people might call it a rash as well around the hands, the feet and the mouth. And they tend to be little spots, so in little dots and clusters, and they can be a bit painful or bothersome for the child. Alongside this virus, you can also get other symptoms that we would see in many other viruses. So a fever, you can get some respiratory symptoms or some tummy problems, so some diarrhea or loose poos. But the thing that really tends to worry parents the most are the spots.
Okay, and so you mentioned that those spots can sometimes be painful. How might this affect your child and how should parents manage that at home?
Yeah, so in general, we can manage this with usual pain relief. So I would usually recommend paracetamol or ibuprofen for this one. What can sometimes happen is that the lesions that can sometimes happen in the mouth, they're like blisters or ulcers inside the mouth. And that can understandably, for any parent who's ever had a mouth ulcer, be very painful. And one of the things that we worry about is whether a child will be able to drink enough to stay hydrated.
And so can you tell us about what you mean by stay hydrated?
So if a child isn't drinking enough through a day, then they can become what we would call dehydrated, a little bit dry. And some of the symptoms of that can be fatigue, so tiredness, having less wet nappies or going to the toilet to do a wee less often, or being generally listless. They can sometimes look dry around their mouth, but in general, the main thing that a parent will notice is that their child just isn't drinking as much as usual.
And what do parents need to do about that?
One of the easiest ways to do this, although let's be honest, none of it's easy, is to give a child small amounts of fluid frequently rather than expecting them to be able to drink a whole cup in one go when it's painful. Giving them pain relief, so paracetamol or ibuprofen, or both can be safely used together, and then encouraging them to drink really whatever they want to drink is the best way to go. I would have a little caution to stay away, if you can, from the more acidic drinks. Things like apple juice and orange juice can sting a little bit more, or if your child really wants them, to water them down so they're a little bit less acidic on those lesions and make them more painful. Drinking things like water, rehydration fluids that you can get from your pharmacy, or other things like milk. Milky drinks can coat the lesions themselves, and sometimes we hear that they make them a little bit less painful. But anything with fluid in it that your child will take. Jelly's a great option here. Things like icy poles. Icy poles have that added benefit of being really cold and making the mouth a little bit numb. So an icy pole followed by a drink can be a great combination.
And sometimes parents worry that their child won't eat anything when they have these symptoms. Is that a problem?
So kids are incredible. They can go for quite a long period of time without eating, so long as they're drinking enough. So if they've reduced their eating for a few days, but they're still drinking well and still making urine, so making wee, then we don't tend to worry for a few days. But we would say seek some local medical advice. So speak to your GP just to make sure that your child's situation is safe.
The other thing that parents sometimes worry about is that these little lesions, as you've called them, spots or sores, might actually get infected, and whether they need any cream or any antibiotics to treat those sores.
So this is a viral infection, so we tend to not treat it with antibiotics. Yes, any type of opening on your skin runs a risk of being infected. So if it was becoming particularly red, we would say speak to your GP. But that's really, really unusual to need antibiotics for this. The best thing is just to leave them alone. Don't pop them. They don't need specific cream. Just leave them alone and they'll heal on their own.
And how long till they typically go away?
It can take a week or two for the sores themselves to heal and to go away. Usually they'll dry up first and look a bit scab-like, and then they'll go away.
One of the questions parents also ask is how long do they need to stay away from childcare, school or kindergarten to help prevent the spread?
So hand, foot and mouth is a contagious virus, so we would recommend that you stay isolated until the sores, till the fluid dries up in the sores and they crust over.
And what about preventing the spread more broadly in the household?
So as I said, this is a very infectious virus, and it's hard to stop it spreading within a household. It's usually spread either through droplets, so through coughing, sneezing, sharing cutlery, sharing drink bottles, or through the sores themselves, the fluid from the sores themselves. So general advice within a household is hand hygiene, so that means washing your hands, particularly after you've coughed or blown your nose, and not sharing cutlery.
Very difficult though when you've got a household of little kids. Hand, foot and mouth is one of those things that will probably visit your home at some point, and it's about supportive care, getting through that episode, and hopefully you don't experience it again.
Absolutely. So thankfully, this is one of those infections that while you can get it again, it does tend to provide some protection. So much more common in little children than in adults. And so hopefully your adults in your household will be protected from this.
Great. There's some good news at least. So more information available for parents on our Kids Health Info fact sheet. Thanks so much for chatting about this really common, bothersome infection with us today, Sarah.
Thanks so much for having me.
Information in this podcast is general in nature and is intended to support, not replace, discussions with your doctor or healthcare professional. If you have concerns about your child, please consult your local healthcare professional for individual advice. This podcast is recorded on the traditional lands of the Wurundjeri people of the Kulin Nation, and we pay respects to their elders. Kids Health Info is funded thanks to the support of the Royal Children's Hospital Good Friday Appeal.